Hey pharmacist, here's 5 things to keep in mind when counseling your patient on this newer inhaler, the Genuair. You may come across this inhaler when dispensing medications such as the Tudorza Genuair and the Duaklir Genuair. To use the Genuair inhaler, there are 2 steps the patients need to do after removing the cap. To remove the cap, the patient would simply squeeze on the arrows on the side and take it away from the device. So the first step is to activate the device. That's done by clicking on this button here and releasing it. Once that's done, the patient will exhale away from the device and then put their lips around the mouthpiece and inhale strongly and deeply to allow the medication inside here to reach their lungs. So that's the basic overview, but there are a few details to keep in mind and to counsel your patient on. So let's get started. Number 1, double feedback mechanism. The Genuair has 2 mechanisms that lets the patient know that they have in fact released the medication from this device. So the first one is a visual cue. When the medication is ready and this has been clicked and released, remember the patient shouldn't hold on to this when they're inhaling. They should let go with their finger. The colored window here will turn green once the dose is ready to go. So when the patient inhales, it'll turn red. That's the first feedback mechanism that tells the patient that the drug has been released. The second is an auditory cue. As the patient is inhaling, they'll hear a click. That's the second way that they'll know that the medication has been delivered. So this is what it'll sound like, and see if you can hear it. Notice the window here is red. That means that the drug has been released. And I hope you heard that click. So again, 2 mechanisms. I just want to mention that if your patient has attempted to inhale and these are not happening and they've tried multiple times, then this may not be the inhaler for them and you may need to consider something else because this does require a strong, deep inhalation and strong lung capacity to do so. Number 2, the indicator decreases by increments of 10. Like many inhalers, the Genuair contains a dose indicator, and this one actually goes down by increments of 10. So that's important to counsel your patient on. Number 3, a red striped band will appear. Speaking of the dose indicator, as the number of doses remaining approaches 0, a red striped band will appear, indicating that there are approximately 10 doses left. So in the case of Tudorza Genuair, which is typically used twice daily, that would mean that the patient has about 5 days left of their medication. So you may want to mention this to your patient because it could be their trigger to contact you to get their next refill ready. Number 4, 0 doesn't mean it's over. When the number 0 appears in the window of the dose indicator, there in fact is medication remaining. The way to know that the inhaler is empty is this press button here will lock and it won't come back up as it typically does. Just be aware that there is 1 dose remaining and every dose counts. So just something to keep your patient aware of. Number 5, device maintenance. Remind your patient that this device does not need to be cleaned. If they do want to clean the mouthpiece, they can do so with a paper towel or a dry towel, but never with water. Conclusion. It has a built-in double feedback mechanism, both visual and auditory, to let the patient know that the dose has been released. The doses decrease by increments of 10. A red striped band will appear as they near the end, which you can let them know that once they see this, they should get their next refill. And the device's activator button will lock once there's 1 dose left. And remember, the device doesn't need to be cleaned, especially not with water. Thanks for watching. Be sure to subscribe to my channel here and for other videos, and stay tuned for more. See you next time. Bye, pharmacist.